Welcome back to the podcast with your host, Samantha.
And I'm Alexa. We're here to light up your life.
Today on the podcast, we're honored to welcome Dr. Alexandria Lightning. She's a board certified nurse practitioner, functional medicine expert, and founder of Lightning VIP, which is a premier concierge wellness clinic. She's a breast cancer survivor and former COVID ICU frontliner. Dr. Lightning brings a powerful real world perspective to healthcare, blending conventional and holistic methods to create lasting transformation. Her passion lies in educating and empowering people to heal at the root level, especially in the areas of weight loss, hormone balance, and detoxification.
Welcome to the show. We're so excited to have you here today.
Thank you. It's an honor to be here.
I know that you are a breast cancer survivor, and I'm assuming had a huge impact on the medicine that you practice today. Can you share a little bit more of that backstory and what led you to your practice and what you do in your line of work today?
Absolutely. I want to first start by saying that a lot of times when people hear that I'm a breast cancer survivor or that I had breast cancer, they go, "Oh my God, I'm so sorry that you went through that." And I have to immediately say, no, getting cancer was one of the biggest blessings that I've ever had in my life. And I'm going to get into why. So when I moved to Las Vegas, it was shortly after being a COVID-19 frontliner. I actually was deployed to New York City back in March 2020 at the height of everything going on. This is when Trump was in office his first term and he was shutting down the borders. I was actually over in Thailand when the borders started closing. I almost got stuck over in Thailand. The people who I flew out there with, they had flights just 2 hours after mine and they got stuck over there. And so I was deployed to New York City at one of the hardest hit hospitals in the Bronx, Lincoln Hospital. And I was working a COVID ICU unit that had like maybe 21, 22 beds in that unit. And it was a good shift if by the end of the day, one person was still alive. The amount of death I saw, the amount of bodies I had to wash, the amount of families I had to call, it was awful. And it was definitely life changing and altering. And so there was lots of conversation around that time of why this virus, where most people were surviving it, what was it about these people who were coming to their death from it? And there was a lot of push and talk about being proactive and preventative, which in theory we say we do in our American sick care system, as I call it, but really it's anything but. And at the time, in my naivety, I said, okay, well, I know my experience of going to the doctor. How could it be preventative? You go to your doctor, and first of all, you wait 45 minutes before you even get back into the room. And then you sit back there for another 20 minutes waiting for the doctor to come into the room. And then they're in for 5 minutes. You're lucky if they sit down, to actually have a conversation with you. They're asking you very to the point questions, and then they rattle off a recommendation and they walk out the room. There's no teaching there. There's no conversation there. There's no context there. There's no background. How are you consulting me and making recommendations for me? And you don't know my lifestyle. You don't know my genetics. You don't know my epigenetics. And so I thought to myself, there's a big teaching component that's missing. And if I were to own my own primary care practice, I could change how medicine is practiced. I could actually take time to spend with my patient, get to know them, find out what stressors are going on in their life, their genetics, epigenetics, lifestyle, environmental toxins, and we could actually teach because after all, that's what the word doctor means. It's to teach. And so if I could do this, we could change medicine. And oh boy, I found out real quickly how naive that thinking was because that way of practicing does not fit within our Western medical healthcare system, unfortunately. How reimbursements are, how insurance is set up, there's no room for that. It is very much, I hate to say it, it is very much a numbers game. It's very much get them in, get them out. There's no time for teaching and doing that type of thing. And so what I found very quickly is, when I first opened up my clinic, I was able to do those things because it was slow. I didn't have a lot of clients. But I also wasn't making any money, but I was able to take my time. Well, as clientele picked up and I started to get more and more patients, I found myself being on the hamster wheel and in the same rat race of everything that I didn't want to be. Now my patients were waiting in the lobby. Now I had to get in and out. Now I didn't have time to sit and have 30 to 45-minute conversations with them. And that broke my heart. And it also gave me compassion for other doctors that I have been to that I was like, oh man, that guy was a jerk. or he didn't seem to be listening. I saw very quickly how providers go in very, very idealistic of how they're going to change the world and help people, and how the system is just not there to support us or the patients. And so, um, the universe has a way of sometimes kicking you off the ledge when you're stuck in a space of indecision. And that's when I got my breast cancer diagnosis. So I was so busy running this practice and being burnt out. I didn't know how to get off the wheel. And the universe said, here, let me kick you off the ledge, help you out. Because when you get cancer, when you are faced with your own mortality, when you think you might die, sooner than later, because we're all going to die, right? You start to really question everything. My life's purpose. Did I accomplish what I wanted to accomplish? Am I really doing what I'm supposed to be doing? Do I really believe in this healthcare system that I'm practicing in? Do I trust now that I am no longer the provider and I'm now the patient, that everything that I have been learning and, using to treat my patients, do I actually believe in it? And so that was the turning point of
Mhm.
me transitioning to functional medicine. I am a social media influencer. So my whole entire cancer journey, I basically vlogged it, posted it on IG lives and stories. And what that invited was an influx of my followers sending me all sorts of information that I never heard of, because I was not into functional medicine, alternative medicine, complementary and alternative therapies at all at that point in time. And so you get cancer, and then you start getting a flooded inbox about CMOS and all sorts of other things to help with cancer. But then you had other healthcare providers who something similar had happened. And I'll never forget, this is what solidified my functional medicine path. I had a cancer scientist come into my DMs, not an oncologist, a cancer scientist. He studied cancer in a lab, and he had been doing it for over 2 decades. And he said to me, I was asking him all sorts of questions. And he said to me, when I asked him, hey, my oncologist told me that what I ate doesn't matter. And I just refuse to believe that. I feel like the research is very clear. What are your thoughts on this? And he said to me, I'll put it like this. You know, the level of the strength of correlation that we have between smoking cigarettes and developing lung cancer, like the strength of correlation. Of course, we all know that you can get lung cancer outside of smoking cigarettes, but we also know that when you smoke cigarettes, you are infinitely more likely to get lung cancer. There's a strong correlation there. So that strength of correlation. And I said, yeah, I understand that strength of correlation. He said, do you know that exact same strength of correlation exists between eating meat and developing colon cancer?
Wow.
And I'm like, what? We have all sorts of tobacco is wacko. I mean, everybody remembers and is traumatized from those tobacco commercials from back in the day.
Mhm.
And we never hear anything about that with meat. So that led to my next question. Well, why do we have such a huge push about that, but not about meat? And I will throw this caveat in here because I know somebody will say something about it. It could possibly be just how we farm and process meat here in America. So I'm not going to say this is worldwide, but at least here in the United States, okay? With all, the GMOs and antibiotics and pesticides and
Mhm.
stuff. But nonetheless, that's what it shows here. And so that's when you go down the rabbit hole of, okay, well, why is that? Well, then you find out that, um, the agriculture industry is in bed with the pharmaceutical industry. It just goes down this rabbit hole. And then ethically, morally, as a healthcare provider, I have to say, my God, what else did I think was one way, but wasn't what it seemed? Because, and this isn't a secret, people suspect it, people know it. Is it beyond our United States government to put out false information or fund projects or get research to say what it wants it to say? Unfortunately, no. We have lots of examples in history of where such a thing has happened. And so we as healthcare providers have to at some point say, okay, I understand that this is what the gold standard is because this is what peer reviewed research says, but nobody goes that extra step to say, okay, but who funded this research? And is this consistent research just here in the United States? Because what's going over in Greece? What's going over in Spain? What's going over in Italy? Are they coming to those same results, or are we just looking at American literature? It goes deep.
Yes, it goes so, so deep. I mean, we've been down the rabbit hole. I know we were at dinner when we were in Texas talking all about this. So, after doing that research and having people reach out to you and sharing your breast cancer journey, what would you say was the big mindset shift? Now you're doing functional medicine, and how is that different from traditional health?
Sure. So functional medicine looks at the root causes of health issues instead of just masking symptoms. And so what happened is I started going to, so I had an estrogen positive, HER2 positive breast cancer. Okay. And so what that basically means is although estrogen and HER2 did not cause my cancer, once it developed, those things in my body were feeding it. Okay. So I got very interested in hormones and functional medicine. And so I started going to conferences. And I heard an actual OBGYN speaking at this conference on hormones, and he was describing me. He didn't even know it, saying about all the risk factors that go into developing breast cancer. Obviously, we were discussing that specifically because it was a hormone conference. And one of the biggest fears that people have on hormones, especially women who are in that perimenopausal or menopausal stages, I'm afraid to do hormones because I heard that they cause cancer. This group was actually saying the exact opposite. No, we have a hormone imbalance issue because of all of our environment toxins. And one of the most proactive things that you can do for your health is to get your hormones balanced or in check, or if they're depleted, getting them back. And so I am the one that should be afraid of them the most, and I'm absolutely not. But hearing how suboptimal labs can basically give you insights of what the future will hold for your health. And me learning that none of those things had been done for me, but I had been going through the symptoms that this OBGYN was describing. One of the things that hit home was when I learned that when your vitamin D level is 60 or higher, you can, there are studies, there's research that shows that women have decreased their chances of developing breast cancer by up to 40%. Number one, no healthcare provider had ever checked my vitamin D level. Number two, at the time of my diagnosis, when it finally was checked, it was 7. And to think of something so easy to decrease my risk factors like a vitamin D, I have no problem buying vitamin D supplements and taking it, but I had no healthcare provider to tell me that information. To think that I could have avoided something so life altering. I went through chemo. I lost all my hair. I went through immunotherapy. I have no breast tissue anymore. I had a complete double mastectomy. Looking back, I wouldn't have done that part. But again, I was still in my learning phase. But I have scars to remind me about this for the rest of my life. I'll never be able to breastfeed a child. And to think that in part, I could have mitigated those chances by just taking some vitamin D. That's so simple. And so that's when I said, I am committed to this path because it's not woo woo. It's not out there. This is scientifically founded stuff that's in the research. That's the other thing that's maddening. This isn't something we're just pulling out of thin air. This is peer reviewed scientific research that shows these things. And we're just not, that has not been adopted or accepted into a standard of care.
Absolutely. I want to take a step back. You mentioned hormone imbalances. What are some of the possible reasons why your hormones might not be balanced?
Yeah, so a lot of it's going to be diet. We're going to start there. We are literally being poisoned by our this. I'm very happy with RFK Jr. being in his position right now because he's bringing to light something that a lot of people are still in the dark. We assume if it's on the shelves, it must not be that unhealthy or it must not be that dangerous because if it was, why would our FDA, allow these products on our shelves? And the evidence is overwhelming. I mean, there are over 800 additives, chemicals, ingredients that are banned over in the UK and other countries that our government allows in our food system. So we are literally causing our own hormonal imbalances, gut dysfunction, because lots of our hormones, 80% about our processed or synthesized in the gut. A lot of us have messed up guts, the GI system, inflammation, intestinal permeability because of how we process packaged food, how we're eating it. So that's one. Then we have environmental things outside of food, like plastics, like radio waves. We use microwaves for our food. We radiate it, things like that. And I think that that cumulative effect of those things is why we are in hormone havoc. Our hormones are a wreck. lots of women have PCOS. Lots of people have Hashimoto's or thyroid disorders. And then, of course, menopause is natural, right? But we are seeing it happen at younger and younger ages. And then we all know about menopause, but there's also andropause. So that's something that men go through and they don't even know it's a thing. Men lose their testosterone over time. And I am finding in my practice that I am seeing men at younger, low testosterone used to be an old man's problem, 50, 60, 70. Now I'm seeing low T in guys in their mid 20s and they don't even know it because nobody thinks to check it because they're in their 20s.
Wow, that's an insane statistic. What do you think is causing that? I know we talked about the food. How do you feel about tap water and then shampoos,
Yes,
deodorants,
yeah.
conditioners people
All
are
that.
using?
So that goes back to when I said environmental toxins, I'm lumping it all in there. Our food source, our water source, our cosmetic and personal care products, all those things definitely play a role. What I like to teach is breaking cycles of generational health. Hear me, generational health. We love to talk about money, right? I'm telling you, somebody says you can make this money here. I'm all ears. I want to learn how to make money. I want to build generational wealth for my family. But what we don't talk about is generational health. We have been so ingrained to think that our health has to be a fate. Oh, autoimmunity runs in my family. Breast cancer runs in my family. Diabetes runs in my family. Obesity runs in my family, as if it's a fatalism. It's going to happen to me because all my aunts have it. All my uncles on my mom's side have prostate cancer. It runs in the family. Okay. We say it like it's like this predetermined genetic predisposition where it's just fate, it's going to happen. And that is a lie. It could not be further from the truth. There is genetics, but then there's a whole field called epigenetics, which is you can have a gene for something that does not mean that your body has to express that gene. What determines if that gene is expressed or not, or turned on or off? Well, that has to do with your environmental factors like your lifestyle, what you're eating, how you're eating it, etc. And so I like to let people know that they have more power than what they think they have because the first step comes with knowledge, right? You have to understand these things that you're being exposed to every day that you think are harmless, but are the things that are taking you down that same health pathway as your aunt, your uncle, your mom, your dad are leading to those same things. It's largely lifestyle choice based.
I love your enthusiasm around seeking knowledge. I do find that there's a lot of information out there, and it's really hard to determine what is right. So we debate this all the time, whether oats are healthy or get eggs good or bad. There's a lot of information out there, and it's tough to determine. For anybody who's trying to become more knowledgeable, what is a good source of truth?
The first thing I want everybody to realize is that you're an individual. That means that you are so unique and there's certain things just about you. And so that's why I hate when people say, get on this diet or everybody should take this vitamin or they should be on this trend because that's maybe true for maybe 80% of people, but maybe not the other 20%. And that's why. So think about this. The reason why in part, or really largely, why our healthcare system is how it is because it's standardized, right? When we start standardizing things, I don't care if it's in health or if it's in education. Think of our education system where we have standardized testing or standardized way of how kids learn. We cut off a certain demographic of, people who may be neurodivergent or have other learning methods because we've standardized how things are. Well, and then people are hurt as a result of that. And that's the same in health. We have to stop standardizing health. Unfortunately, when you depend on a government to take care of you and things like that and set these standards, that's what happens because it's a system. They have to standardize things. They have to give everybody the same thing. And that hurts people. And so when it comes to your health, you have to remember you're an individual. So we have to find out what works for you. And that's why I love functional medicine. We do deep dive panels to look at metabolic health, to look at your kidney functioning, your cellular health, to look at your cortisol and stress levels, to look at hormones, to look at trace element and nutrient deficiencies. We'll do genetic testing. We will do food sensitivity panels, and we will customize what you need according to you. Because Alexa, eggs may be great for you, but Samantha, they may be the devil for you. So for me to say, blanketly eggs are good or eggs are bad for you would be very, very naive and ignorant and misinformed to say. And so functional medicine doesn't do what traditional medicine does. And traditional medicine, which is insurance led, the insurance says we will cover these amount of labs and no more and no less. And it's such a small, finite view that it only gives the doctor this little bit of a window to determine what's going on, which is not enough. And so functional medicine says we're getting rid of insurance. Most of us have negotiated very great rates with labs that we partner with to get full panels so that we can look at all these different aspects of your body specifically and put together a clinical and genetic picture for you specifically. And then we go further. We say, okay, it's annoying because, people hate paperwork, but it's like, then we do a long questionnaire about lifestyle. Who do you live with? How's your relationship with them right now? What's your movement like? If you're meal prepping, how are you meal prepping? Are you putting it in all those plastic containers and then microwaving it? Or are you putting it in ceramic and glass or bamboo? These things all matter, and putting together what should Samantha be eating? What should Samantha be staying away from? Where else can she detox to improve these things naturally without having to do a medication or supplement at all? That would be my answer to that, is that there is no one size fits all or one glove fits all. That's why the in-depth and advanced testing is so important.
Yeah, I love that approach because, like you said, everyone is individualized and you have that concierge approach to it. After working with so many clients, what would be the commonalities you see between them? And what are some of the fixes, the root cause that you offer your patients?
Wow, that's an easy one. I would say about 85% of the people who I check have some type of insulin resistance and they don't even know it. And that's huge because the number one cause of death in the United States is heart disease. Most people don't realize that. They think of heart disease, so heart attack, stroke, things like that, and they automatically associate that with cholesterol, right? So putting two and two together, seemingly, they say, so fat, if I stay away from fat, if I don't eat red meats or things that are full of fat, then I should be good. And that couldn't be further from the truth. The number one cause of high cholesterol and heart disease is sugar. It's carbs. And so you have people who say, well, I don't eat eggs because, the yolk, it has cholesterol in it. And I only do egg whites, or they stay away from eggs altogether, or I don't do red meat. I just eat vegetables and fruits. Those are full, especially the starchy vegetables, full of sugar. So they're shocked when they find out that they've developed diabetes or pre-diabetes because they thought I was eating so good or so clean. How did this happen? And it's sugar. The problem is, and this goes into my next point, besides the full panel that we do compared to your regular doctor, it's how we interpret those labs. Because a lot of doctors will say, a lot of people will come to me and say, well, can't you just give me the lab panel and I'll take it to my doctor so they can order it? Well, sure. But one, you might end up with a very hefty bill afterwards because of insurance requirements. But two, the doctor will often not interpret them according to functional medicine ranges. So they are still giving people a false sense of security, saying everything's good when it's not. The example of this would be going back to the insulin resistance. Is a lot of people say, well, I know it's not my sugar. My sugar's good. My doctor checked that. And I'll say, okay, what did they check? Well, they said that they checked whatever it is that they have to check for that. Okay, but what are those tests? So we'll go back and find out that usually it's been a glucose or blood sugar and a hemoglobin A1C. That's not good enough. It gets missed all the time. What we need is also an insulin, because what we will find is that somebody will have a perfectly normal blood sugar and a perfectly number A1C. But why? It's because that pancreas is working so hard, kicking out insulin, high levels of insulin, more insulin than the body should ever have in it at one time. And eventually, and so, yeah, right now your sugar and your A1C looks good, but after a while, your pancreas is going to get tired and your cells are going to become insulin resistant and it's going to stop responding. And usually by the time this research shows that by the time somebody is diagnosed with diabetes, most of the time their pancreatic function has been reduced by 50%, and that's irreversible. And so we are waiting, and the way we're interpreting labs is at the point where disease has already set in and usually at an irreversible point. And so insulin resistance is something I see often. Vitamin D deficiency is something that I see often. Heart disease, or the beginnings of it, is something that I see often, again, with specialized tests. And that's important because 50% of people find out that they have heart disease when they have their very first heart attack. Blood pressure was normal, cholesterol levels were normal, and they still had a heart attack. And that was their first clue that they had heart disease. Because again, they were given a false sense of security. Oh, I had my annual lab panel. Doctor said everything was good. Cholesterol numbers were good. Blood pressure was good. I'm good. And then they have a heart attack. We're not doing the right tests. We're not interpreting them the right way according to our standard of care in Western medicine.
Oh my gosh, that is scary, right? I mean, the fact that some of the damage that you can appear healthy, you're going to your regular practitioner and you believe that you're healthy and you might have irreversible damage, that is scary to think about. If you had to give three recommendations to our listeners, how would you advocate? Why is it important to teach functional medicine and finding a root cause?
Yeah, I don't want anybody's first wake up call to be cancer, like how it was for me. Okay. That doesn't, and I was 33 years old. So don't think, oh, well, I'll worry about that when I'm in my 40s. No, 33 years old. And then when I started joining support groups while I was going through my cancer journey, there were women much younger than me, as young as 18, 19 years old, with full blown breast cancer. I had a friend that was 24, breast cancer, and died from it. Okay. So this isn't something that you worry about later on. The decisions that you are doing right now, today, are what translate later on into all those chronic conditions that we're trying to avoid. And so, a few things that I would say as far as self advocacy is one, to find yourself a functional medicine provider. Read the reviews. It's tricky with functional medicine because it's not like a branch of medicine that's taught in school. And that's actually probably a good thing because it would probably become corrupt, to be completely honest with you. If it started getting funded by the government and stuff like that and added into the curriculum. But one, finding a good functional medicine provider who's going to support you, because there's lots of things that I can tell you, oh, you need to do this, but then you go to your doctor and you ask for it, and your doctor will simply just say no. So you have to align yourself with a provider who's going to be open minded enough to at least say, well, you know what? Let's talk about that. So that's one. Two, I tell everybody about the Yuka app, Yuka, Yuka. Download it right now. Yuka lets you scan food and personal care products to see if they contain harmful ingredients. So that empowers you to make smarter choices about what you are putting in and on your body. And detoxification is a thing. We don't drink enough water. So 70% of us are chronically dehydrated. One of the best things people can start to do is just cut out everything except for water, and then do other things, drinking mineralized water, dry brushing, rebounding, which is jumping up and down on a mini trampoline. Over in Finland, they use saunas regularly. And there's research that shows that when you sauna, even if it's just 15, 20 minutes a day, 4 to 7 days a week, you decrease your chances of all cause mortality. That is, you decrease your chances of dying from anything by up to 40% because you're sweating and you're detoxing out. We think of these things as a luxury here in the United States. Oh, I'm going to go to the spa and sit in the sauna. Like, no, if you can get one of those infrared saunas for $1,000, $2,000, $3,000 off of Facebook Marketplace or Craigslist and have that a regular thing in your home, that is an investment that's worth it for your health.
We both use the Yuka app all the time and we sauna regularly. But one thing is you have to worry about what you're wearing, because I find a lot of times when I go into the sauna, you're sweating. But if you're wearing materials that are really bad for you, it's seeping into your bloodstream. So if you can talk a little bit more about that.
Yeah, so PFAs, forever chemicals, that clothing is sprayed down. Girl, I love my Lululemon. I love my little leggings and joggers. But it's literally in everything. And that's why I have functional medicine programs for this, because it becomes tedious, honestly, and it's something that can't be done overnight. So that's why I have 3 and 6 month programs, so that we deconstruct and we make these small changes, small sustainable changes, because it's a lot. You really want to get into it. It really is a lot, between changing how you eat, how you cook, what you wear, the personal care products in our clothing. Yeah, it's everywhere. And so, but when the goal is to decrease allostatic load, that is the cumulative sum of all these small things that are piling up, ultimately affecting the expression of how your health is, whether that's good, bad, or other. And so I tell people, hey, listen, the first step is let's do a deep dive panel. I've created something called the power panel, and it says, let's just see where you stand. Let's see if you're as healthy as you think you are. People are shocked when I do this panel on them. And so I tell people, I can order that even if I can't treat you personally. I can still do health coaching. And I have partnered with labs across the United States where I can still order this panel for anybody in the United States except for New York and New Jersey and Rhode Island. That's because of their own state laws. But anybody else, anywhere else, I can at least do that deep dive panel so that they can see where they stand. I would tell your listeners that if they want to know that for themselves, they could text the word root, ROOT, for root cause to 26786. That will give them the information that they need to say, hey, I want to get this deep dive power panel done to see where I stand in all these areas so that I can start getting on the road to having autonomy and empowerment over my own body, taking control of my own health instead of depending on this broken healthcare system.
Yes, amen to that for sure. To wrap this up, where can our audience connect with you and learn more about your programs and services?
Yeah, so the best way to connect with me directly would be my Instagram, and that's Alexandria_Lightning. Lightning like thunder and lightning, LIGHTNING. I'm on Instagram. My website is www.lightningvip.com. And again, texting the word root to 26786 will lead you to more information about the deep dive power panel. It actually leads you to a complimentary consultation with me to see if it's something that's right for you.
Amazing. Well, thank you so much again for being here today. And we're sending our listeners so much love and light.
Thank you for having me.